know them all. 1 in 6 people over the age of 60 have experienced some form of abuse in a community setting in the past year. All of us here have heard of animal abuse and child abuse, but we might not be aware of the abuse that's happening to our elderly population behind our backs. The Centers for Medicare and Medicaid Services need to do more to regulate the nursing home industry and improve the standard of living. First today, I'll talk to you about some of the problems and challenges that nursing homes face, and then I'll talk to you about some of the solutions that we can work on to improve them for our elderly. The rate of elderly abuse has gone up in the past year, with 2 in 3 staff reporting abuse in the past year alone. This comes from a study done by the World Health Organization by its head, Dr. Tedros Adhanom Ghebreyesus, in their study, Abuse of Older People, conducted June 2022. This rate of abuse of 1 in 6 and 2 in 3 staff is expected to rise due to the aging population of the entire world. There was an abuse caught. There's a study to find how much abuse was caught onto in each and every nursing home and how it was reacted to. The 3 main abuses studied were co-residential abuse, relative abuse, and staff abuse. Co-residential abuse was thought to be typical in day-to-day life in nursing homes. There was little to no intervention done when it was observed. As for relative abuse, it was seen as a completely private affair, and staff was to not intervene even if it was physical abuse of a patient in the home. And as for staff on patient abuse, it was thought to be completely unthinkable. There were no meetings, there was no intervention staged, and there was no coworkers reported for abuse observed. This comes from a study done by Jonna Meyer from the Department of Public Services Nursing Facility and Medicine and Health Sciences, Norwegian University of Science and Technology, Trondheim, Norway, in their study, Elder Abuse and Neglect, an Overlooked Patient Safety Issue. There are many challenges that come with improving nursing homes. There's a study done on special care units to see whether or not they made a difference in the amount of abuse observed in a nursing home. Out of 4,599 workers, 400 units, and 156 faculties, 50.8% saw emotional abuse, 23.7% saw neglect, and 1.4% saw physical abuse of patients. There was little to no difference in nursing homes that had special care units versus nursing homes that did not have the special care units in them. Those numbers come from Olivia Bloomfield-Ahrens, who is from the Institute of Nursing Science and University of Basel, Switzerland, in their journal Genealogy, published February 2017. Elderly people are not always able to help themselves. They are not always able to advocate. They might not be well enough in the mind to report if they've been abused, and they might not be well enough in the body to advocate for themselves or even know they're being abused. That sort of method of thinking comes from Tamara Konecka, who is a part of the Department of Public Health Sciences in Chicago, Illinois, from their journal, The Challenges of Improving Nursing Home Quality, published January in 2022. It is also very difficult to find solutions for abuse because the problem is just so diverse. There's so many cultures, there's so many methods of taking care of people that you can't always find abuse in every single one. That's also from a study by Dr. Tedros Adhanom Ghebreyesus from the World Health Organization. In a policy brief done by the WHO on tackling the abuse of older people, the 5 priorities for the United Nations in their Decade of Healthy Aging for 2021 through 2030, published June 2022. Now that I've talked to you about some of the problems and challenges that nursing homes look at when they have to deal with abuse, I'll talk to you about some of the solutions that we can look at to improve the standard of living. Usually abuse stems from a few key things: a poor level of care and a poor life environment for the patients, a low ratio of patient to staff members, and a just general job dissatisfaction with the people in that industry. A way that we can look at to improving our nursing homes is to even out the workload by hiring more staff members per patient so that you can keep it balanced and it's not so much stress on some of your staff members, and that will raise the quality of living. This idea comes from Tenzin Wangamo, who is a PhD from the Institute of Biomedical Ethics University in Basel, Switzerland, in the Journal of Geriatric Nursing, published October 2017. Another thing we can look to do is educate our nurses themselves. It was found that a lot of them didn't really know what all abuse could qualify as, and sometimes they were letting abuse slide in nursing homes when they could have been preventing it. Another thing we can look at doing is implementing intervention strategies by getting together a group of intervention developers to help make it more, to help pool resources to get more intervention strategies and better prevention pathways for those nursing homes to stop abuse. So now that I've talked to you about some of the challenges and problems in nursing homes and some of the solutions that we should look at in implementing, the Centers for Medicare and Medicaid Services need to do more to regulate the nursing home industry. That way, we can improve life for all of our elderly patients. Because if we do not, that statistic of only 1 in 6 will get much higher, and